This presentation will discuss Rogers and person-centered therapy and theory behind person-centered therapy. This is for the completion of a doctoral degree in clinical psychology with California Southern University for course History and Systems of Psychology. For some background for Carl Rogers, Rogers was born on January 8th in 1902 in Illinois in the United States of America. His parents' names were Walter and Julia Rogers. He also had 5 siblings. Amongst his 5 siblings, his parents viewed him as a more sensitive child, while the expressions of emotions were not encouraged by his family. With this, he had very few friends as a child, but made some more friends while he was away at university. As a teenager, Rogers developed a love of working in nature and the knowledge of the scientific method while he worked on his family's farm and their land. His parents were also known to be conservative Protestants, raising him in a more strict household where his emotions were not encouraged to be expressed. Rogers did an undergraduate degree at the University of Wisconsin. He then proceeded to start graduate school at Union Theological Seminary, but decided to not complete his theological degree and left after only 2 years of seminary school. He then moved on to complete his MA and PhD in psychology from Columbia University, and he graduated in 1931. So, what is the impact of family issues on Rogers' theory? So, as stated previously, Rogers grew up in a very sheltered home and was not encouraged to express his emotions and feelings to those around him. Therefore, he did not have a lot of close friends, and his social circle was primarily just his family. The non-acceptance of emotions, showing emotions, feeling emotions in and around the house impacted the theory that he later named client-centered therapy or person-centered therapy. Unconditional positive regard is a huge key aspect within Rogers' theory, which may have come out of his own feelings as a child of not having that unconditional love, but rather having conditions on the love that he received from his family, particularly his parents. The suppressing of his emotions may have caused some internal and external conflict as he grew up. Again, pressing for the importance around empathy and unconditional positive regard within his theory. Rogers' major theory was considered to be person-centered therapy or client-centered therapy. The belief that through establishing a relationship with an understanding and accepting therapist can resolve challenges and help clients better understand and gain insight that is necessary to restructure their lives. This became known as the unconditional positive regard, one of his 3 core beliefs and core conditions within person-centered therapy. Rogers' 3 core conditions were unconditional positive regard, empathy, and genuineness. Rogers believed that counselors and psychologists should learn to work with people rather than treat them like they are experiments. He looked at the ideal self versus the real self, with the ideal self being the person that you want to be, while the real self is the person that you actually are here and now. Person-centered therapy is grounded in the philosophy that people are naturally motivated to achieve positive psychological functioning. The client is the expert of their own lives and therefore should lead the general direction of therapy, allowing for the therapist to take a more non-directive approach to the therapeutic process. The therapist's role is simply to provide clients with a safe space for self-exploration, allowing for them to explore their feelings and gain a better understanding of themselves, leading to psychological growth. Key conditions for effective therapy in the eyes of Rogers were client responsibility, a warm and welcoming environment, and the acceptance of feelings. So, what is the impact of person-centered therapy today? Person-centered therapy today in our modern times is still widely used and considered a kind of gold standard for how therapists should interact with clients in a therapeutic setting, as unconditional positive regard and empathy and genuineness are three key ingredients to many therapeutic techniques that we use with our clients. Rogers was also central in the developing of new ethical standards for psychotherapy, including emphasizing confidentiality and client autonomy in the course of therapy. Rogers stated that clients should give consent before being recorded in a therapy session, and that therapists should not be sharing private or confidential information about a client with others, without their knowledge especially, or without their consent. Rogers believed that therapists recording their sessions and listening to them later on could help improve their skills as a therapist. So when he was a teacher, this was a huge part of how he helped teach his students how to become better therapists. The cultural understanding and views within person-centered therapy. Prior to the 1970s, there was a lack of empirical evidence to support the work of person-centered theory with ethnic and racial minority groups. However, by the 1990s, as more research had been done on using person-centered therapy with other cultures, including collectivist cultures, it was seen that it could be useful as long as therapists are taking the appropriate approach when working with clients of a non-Western background. Empathy as a key component to multicultural counseling was also emphasized throughout this research, which is also one of Rogers' three core conditions. Some critics have come out about PCT being best for culture-specific populations, as it was developed in a Western culture with a more individualistic thought behind it. So this is something to keep in mind when using person-centered theory or person-centered therapy with someone who was not raised in a Westernized culture. So, like any theory, there are some systematic biases that need to be addressed when looking at person-centered therapy. So just like any theory, there are always potentials for biases that come out of a therapist's own values and beliefs. So while this is not unique to just person-centered therapy, it does need to be addressed in the therapeutic process that a therapist is addressing and putting aside their own biases and personal beliefs for the benefit of the client. Potential for personal belief bias with therapists trying to impose their own personal values onto a client, which can undermine clients' autonomy within the therapeutic process. Therefore, therapists need to be aware of their own biases around gender and sexuality and those within that diverse population in order to reduce the risk of silencing their clients on this topic amongst other topics. Person-centered therapy does not address any theory of development or deal with any potential issues of transference or psychopathology, which has also been noted as one of its limitations. A lack of directiveness, which can be both a strength and a weakness, is also seen throughout using person-centered therapy. And some clients may need a more directive approach and be given more direction within therapy than others in order for them to find therapy effective. So, this is all about gauging for your client what is going to be most helpful, whether they need a bit more direction or they're feeling comfortable with a lack of directiveness in order for them to lead the way a little bit more. Ethics. So, historically, Rogers was key in helping the American Psychological Association to include more psychological disciplines within the field of psychology, including applied, academic, and clinical psychology. Much of this was done during his time as APA president. Currently in professional practice, he was the first to emphasize the importance of confidentiality for clients and the implementation of consent for recordings of sessions, either audio and video or either or, which is now a widespread standard practice for counseling and psychology services. Rogers also helped expand the practice of humanistic psychology to international settings to help resolve national social conflicts and political oppression. Research on the effectiveness of psychotherapy became more common following Rogers' work. Conclusion. So, my personal use of person-centered theory and person-centered therapy. So, empathy and client autonomy becoming key practices within trauma therapies and while working with queer people and queer populations in order to develop an effective therapeutic rapport. When working with clients, having them feel that they are welcomed and they are supported in the therapeutic space that I provide is also a key practice that I try to bring to every single day and every single session with my clients. Ensuring that all clients, regardless of age, are informed about consent and have the right to say no to being recorded in session is also something that I practice on a regular basis. Clients always know that they are welcome to say, I would not like this session recorded today if they are feeling uncomfortable about a certain topic that they are going to be talking about. Using the 3 core conditions of empathy, unconditional positive regard, and genuineness with all clients, regardless of which therapeutic modality that I end up using with that client, including EMDR, trauma-focused CBT, or IFS, or parts work, is also really important for my clients to feel that they are accepted and that they are being listened to when they enter into this space. This is a list of references that I used throughout this presentation.